Amsterdam UMC. Et donc, je vais continuer en anglais pour la présenter, comme la conférence se déroulera en anglais aujourd'hui. Vous serez libre aussi de poser vos questions en français et en anglais. Je les traduirai si vous les écrivez dans le chat. Ou je pourrais les traduire aussi si vous les formulez en anglais à l'oral. So, to introduce Dr. Giulia Inguaggiato, she's a postdoctoral researcher and teacher at the Department of Ethics, Law and Humanities at the AmsterdamUMC, i.e. Amsterdam University Medical Centers. She has a background in philosophy and bioethics with a primary research interest in applied ethics. Her focus lies in exploring the intersection between philosophical ethical reflection and the practice of moral reasoning and ethics education in healthcare and also in research. This interest is reflected in her work in the field of clinical ethics support and research integrity. In both domains, Giulia has explored how to support professionals in dealing with the ethical issues they encounter in their work. Her doctoral project, which I had a chance to review as an external examiner for a doctoral dissertation, focused on clinical ethics support and explored the relevance of American pragmatist philosophy for the practice and theory of clinical ethics support in societies such as ours, pluralistic societies. In parallel to this, her work in the field of research integrity has been focusing on the creation of a community-based platform to support researchers in their day-to-day practices. This is a project called, evocatively, the Embassy of Good Science. And she also works on the development of a train-the-trainer program for research and integrity based on a virtue ethics approach, which is a specific approach in ethics theory. And this is funded by the European Union. And these projects are called EnTIRE and VIRT2UE. Giulia is also a moral case deliberation facilitator. This is a famous approach developed in Amsterdam, the MCD approach, which is basically now known across Europe. And so she's a facilitator and trainer, and she's currently one of the coordinators of the research integrity course for PhD students at the Amsterdam University Medical Centers. She's also coordinator for the VIRTU International Research Integrity the Trainer Program. And currently she's involved in two EU-funded projects on research integrity. The Beyond project, which is focused on training, and another project, the Prepared project, supports researchers in conducting research in times of crises such as pandemics, natural disasters, and wars, unfortunately, which we are getting kind of to know increasingly in the past couple of years. So as I mentioned earlier this year, 2023, she defended a wonderful doctoral dissertation. And today, I believe she will build from this work to present a lecture titled Tools for Dialogue, a Pragmatist Approach to Moral Reasoning in Healthcare and Research. So thanks for joining us, and I'll be coming back to moderate this session. Thank you.
Good afternoon, everyone. Welcome to all of you in the room and to those of you who are online. Thank you, Professor Racine. Thank you, Eric, for the warm introduction. It is an absolute pleasure to be here with all of you, and I'm really happy to have the chance to share with you some of the ideas that I've been busy with in the last years. So as Eric said, I'm going to talk about sorry, just testing this. Stop working. So the outline of my talk. So I'm going to start by explaining what do I mean by moral reasoning. Then I will introduce pragmatism and specifically some ideas which I found helpful myself to think about moral reasoning. Then I will give you some examples of how moral reasoning can be fostered in different contexts, such as healthcare and research. And then I will give you an example of an ethics education program that we have developed following a pragmatist approach. So let's set the context. What do I mean by moral reasoning? Where moral reasoning, I believe, is a part of everyday life. We're all moral experts, we're all ethical experts in the way that we're all called every single day to make decisions about what is right, what is wrong. And we try to do that, trying to stay close and faithful to our own moral compasses, to our set of values, to our cultural, religious background. But this is not always easy. Sometimes it is difficult. Sometimes those habits, those moral intuitions that normally guide us are not there to support us anymore. And this is something that happens, for instance, in healthcare. So healthcare is an intrinsically moral activity. Healthcare professionals have to deal with these sorts of questions on a regular basis, I would say. So they have to interrogate themselves about questions around good care. What is good care? What is the best interest of the patient? And they have to make these decisions taking into account the uniqueness of each patient that needs care and the right to live in accordance to their own values and beliefs. So these questions that healthcare professionals have to deal are much more complicated in our own societies, where we have to respect the diversity at stake and we have to treat each individual according to their own needs. In research, it's not any easy. Someone said that being a good researcher means doing the right thing when no one is watching. But we know, for those of us who are researchers, that there are constraints, there are difficulties there as well. So most of us have precarious contracts or have to face lack of resources, lack of funding. There is, in many contexts, a very strong hierarchy that, for instance, prevents junior researchers to do what they think is the right thing because they might fear repercussions on their career, or they might fear to upset their supervisors or other members of the department. And of course, researchers also work under a lot of pressure. So they also face dilemmas and questions about what the right thing to do is. And this might be around authorship, they might be around data management, fabrication, funding, many different things. So professionals in general do encounter ethical challenges in their work. And ethics is still perceived in many ways as policing. So when we bring up ethics, a lot of people get a little bit defensive. They're like, oh, I know what are the rules. I'm following that. I know what is right. So it's really difficult to enter sometimes conversations about ethics. And this also happens in the acknowledgement that knowing about codes and rules and principles is not enough. There are also gray areas, situations in which those guidelines, yes, they do support us, but they don't really tell us what to do. Also, this guideline might conflict with common practices within certain environments. So certain practices that become common might be actually in contrast with what guidelines and regulation tell us. And this creates situations of moral distress. So those situations in which we know what we would like to do in order to stay close to our moral compasses, but there are external constraints that prevent us from doing so. So in sum, reality is much more messy than we expect it to be. As I said, sometimes we might know what we want to do, but we might not be in the position to do it. We might experience conflict between different values that we deem important, but which are in contrast in a specific situation. We might be in disagreement with our colleagues, so we might have to face conflict with our collaborators, with the people who work with us. So how can we support professionals with this messiness, with the messiness of everyday ethical challenges? Well, in the last year, I have been looking at pragmatism. And it's not that pragmatism provides us an answer to that question. That's not what it does, but it helped me in at least supporting my thinking around how can we do this, how can we organize this. So pragmatism is a very big movement. A lot of authors have called themselves pragmatists, and so I of course do not give justice to the movement itself, but I looked specifically at these three authors. And so I looked at Peirce, I looked at James, and at Dewey, and particularly at Dewey. And what these authors sort of had in common is that they set aside the question about the absolute foundations of knowledge. So they were not there trying to find out what is the essence of things, but they tried to reflect on what are the practical consequences of our concepts and our ideas. And hopefully we will understand a little bit better what I mean by this as we proceed in our talk. So I think among these authors, Dewey is the one who really helped me the most, because he reflected on what is the nature of ethics and what is the nature of moral reasoning. And he thought that moral reasoning is a way to adapt to a continuously changing reality. It's a way that human beings have to develop tools to face problematic situations, so to develop ideas that help us to act. Basically, he believed that ethical theories is part of conduct. Ethics is not something that can be found in books, but can be found in our lives when we decide to do something, when we decide to act. And he also believed that it is an intersubjective and democratic process. So it is a process in which we need others. It's not something that can be done in isolation, but it requires collaboration and the inclusion of many different voices. So to sum up, basically he thought, as an ethicist, what should I do is I should start reflecting, starting from those problems that people actually meet in their own lives. That's the starting point of ethical reflection. Now, I will now try to go into these three ideas a little bit more in depth. So what do we mean when we say that ethics is a way to adapt to a continuously changing reality? Well, the way I visualize this is a circular movement. So ethics is very much alive. It's something that is in continuous development. And what does this mean? Well, as human beings, we live in a world in which we are subjected to many different influence. We go to school, we have families, we have friends, we might go to church. So we sort of develop habits. We develop moral habits that allow us to navigate the world, to make decisions. But sometimes these moral habits don't support us anymore in facing our everyday life. So there is when doubt arises. Think about, for instance, in the domain of ethics, think about AI. This is a new thing. It just came about recently. And we're now trying to wrap our heads around this concept, trying to understand how do we deal with this? Our previous habits, our previous theories, guidelines, yes, they do support us. They ground us, they give us guidance, but maybe they're not entirely suitable to address these new problems. So that's where ethical reflections start. And in collaboration with others, we can develop new moral understandings, new theories. We can enrich these habits that we have. We can modify them or change them in order to find a way to face that doubt, to face that problem. And then we will test these new moral understandings in experience, and then if this will be successful in providing us with the guidance that we require, then they will become habits, and the circle continues. And you don't have to think about this process as a revolutionary process. It's not that every time we go back to our habits and we scratch the page and we say, no, this is absolutely terrible, let's put it in the trash. No, it can be a very, very little circle. It can be that the new moral understanding just means understanding what a certain rule, a certain principle, or a certain value means to us in a specific situation. But it's a process in which we constantly move and learn and develop. Then the next idea that I had on my first slide was the one about theories being tools. Well, Dewey thought that theories and principles cannot provide us with answers themselves on what to do. But there are instruments, there are tools that allow us to come to solutions. So they give us an entry point to those doubts, to those problems, and they give us some tools to reflect on them to come to answers to those doubts and those problems. So what Dewey invites us to do, but actually I must say all the pragmatist authors encourage us to do, is to bridge theory and practice and ask ourselves, what effect does a theory produce in our lives in moral terms? And think about, for instance, a situation in which a patient doesn't want to be informed about the side effects of the therapy that they will be starting. What do? Well, you want to, of course, stay close to the principle of autonomy. But what does autonomy mean in this situation? Maybe you have to refine it, you have to contextualize it, you have to understand what is the experiential, what is the experience of this patient. So this is what I mean. So, and this also means that we have to realize that theories, like tools, evolve. I really like the metaphor of the carpenter. A carpenter selects their tools depending on the type of wood that they have to carve. So the same tool cannot be used every day for every type of wood. In the same way, our theories evolve, they change. And they have to change, especially in response to the request of recognition of new voices that bring in new perspectives that we have to address. So the third idea is the idea that inquiry requires democratic processes. And here again, I have an evocative and a bit funny image of these people in a white coat trying to understand what do they have in front of them. And each of them has a partial understanding of what they're touching because they can't see, if I remember correctly. And so if they put together their knowledge, they will eventually understand what they're looking at. So this is the type of process that we need in ethics as well. We need others to verify and expand our knowledge, but also to disagree with us. We should welcome disagreement as an opportunity to refine and create new knowledge. And Dewey also acknowledges that, again, as I said before, we need to allow criticism because we need to allow current models to be criticized by those who have less visibility, who has less strong voices. We should give them a megaphone and make sure that they can also contribute to this process of refinement and continuous moral learning. So the inclusion of different voices, the inclusion of different perspectives, especially those who are not in line with the current one, is really important, according to Dewey. So to sum up, and this is going to be maybe the end of the most theoretical part of my talk, then we dive into practice. So to sum up, pragmatism provides us with a good theoretical framework that can justify why we need to invest in moral reasoning within professional and non-professional practices, but it also gives us tools to do so. It provides us with a sort of attitude and a theoretical orientation to do so. So to summarize, doubts and disagreements become stimuli for moral learning. So they're not repressed, but they are embraced as positive stimuli. Ethical theories are transformed into tools for actions and not dogmas, so they're made flexible and they are connected to the everyday practice. Democracy and intersubjective processes are embraced as fundamental part of moral reasoning. So in general, so this attitude, this pragmatist framework enables us to make human experience, human and professional experience, a fundamental part of ethics reflection, and it also helps us to bring ethics out into the world and outside of the domain of experts, outside of academia, where actually ethics lives. So what does this mean then for the practice of moral reasoning, for creating spaces where moral reasoning can happen within healthcare and research? As I said, I will give you some examples from practice, and I will talk about moral case deliberation used in clinical ethics support and in research integrity, and then I will give you an example of how ethics education can be structured by taking a pragmatist approach. So what is moral case deliberation? Eric already mentioned it in my introduction. Well, it is a methodically structured dialogue facilitated by an ethicist, but just by a trained person, let's say, it doesn't need to be an ethicist, between professionals among their own, like about their own moral questions, exploring therefore a concrete case. And it can be done using different methods. And this means that this dialogue can be structured using different steps. There's not just one way of facilitating this sort of shared reflection, but there are certain characteristics that remain stable, that remain consistent across the different methods that can be used to facilitate moral case deliberation. The first one is that it always starts from the experience and the expertise of the people who are experiencing a doubt. It explores perspectives of different stakeholders, of all the stakeholders involved in the case, using dialogue as a tool. It also fosters the exploration of differences, agreements, and the possibility of consensus, although consensus is not necessarily the goal, but more a process of moral learning or shared moral learning when new knowledge comes about. And it is, in general, action-oriented. So why do I think that MCD is pragmatist? There are 4 aspects that I'd like to underline today in this talk. So the first one is reminding us that in moral case deliberation, we start from a living doubt. We never discuss fictional cases. We discuss the case of someone who is experiencing the doubt. And the reason why we do this is because we believe that the contextual details of the situation are of essence in order to be able to understand what are we talking about. All the participants in the room need to be able to put themselves in the shoes of the person who is presenting the case. They need to live, they need to feel that the doubt is living, is allowed, is pressing, is real. So this is one of the characteristics that I think makes MCD pragmatist. The second one is about the use of theories and moral intuitions. So moral intuitions and theories are brought about in dialogue during MCD as tools, but people are encouraged to make them flexible, to unstiffen them. So they are asked and encouraged to take an anti-dogmatic approach to their own presupposition and to allow for learning and change to happen. And this is, of course, one of the presuppositions of dialogue. When we enter a dialogue, we have to be ready to put aside our pre-understanding of the situation and welcome others' perspectives on the case in order to enlarge our understanding of the situation at stake. The third element is about linking theories and practice. So establishing what is the practical meaning of those moral principles that we normally rely upon, or of our moral intuitions. What does it mean for me to value care in a particular situation? What does it mean to cherish or to honor autonomy in a particular situation? So in whatever MCD method we're using, there's always a step in which participants are asked to link their moral presuppositions, for instance, their values, to a norm of action. So if for instance, if I value care, it means I should always take into account what are the values dear to the patient. This could be an example. Or link, for instance, virtues to behaviors. For instance, if I want to be a good researcher, I want to be honest. What does it mean to be honest in this specific situation we're talking about? Maybe it means that I have to speak up. I have to have courage and go to my supervisor and tell them that this author cannot be on my paper, for instance. So there's always this link that is made between ethical theories and practice. And last but not least, perspectives are explored, diversity is embraced, is cherished, disagreement is cherished as a stimuli to produce new knowledge. And the ultimate goal of these sessions is always to co-create new moral knowledge, to expand our knowledge through the conversation about a specific case, a real case that one of the participants is experiencing. And the last, sorry, I forgot, there was the last one, is this sort of circularity. We start from practice. So we start from the living doubt. We go through this process of democratic and intersubjective dialogue. Then we come to conclusion, and then we go back to the living doubt. So there's this circularity between theory and practice that we saw also in one of the slides at the beginning of the talk. So how do we use this in healthcare and research? How is MCD used? Of course, there are many different ways that MCD is actually used. I will, in this talk, just touch upon some. So for instance, it is used in clinical ethics support. So clinical ethics support has been established not only in Europe, but in the world. And normally it addresses cases and questions. So through MCD, professionals discuss their own questions, and sometimes they do so because they have to actually find a solution. So sometimes this, I was saying before, the consensus is not necessarily the goal. Well, there are some situations in which actually consensus has to be the goal, or at least a decision on how to act has to be made. It is also used in ethics training and education. For instance, when it's used on a regular basis. So it's not just something that is done in acute situations, but really as a training, as a more, let's say, extensive training program. And then it can also be used as at a more policy level to facilitate cultural change, or also to support decision-making about certain direction in which institutions have to go. It is used also in research integrity education, and this is something that I do myself. And we encourage this sort of moral reasoning processes in order to make students aware of the principles and values that are important for research integrity, important to become researchers. Through MCD methods, students also are supported in reflecting on what does it mean for them to be good researcher. And what does it mean in their daily practices. But also, and this is very interesting, this MCD sessions actually support them in developing their own dialogical skills that then they use themselves to approach these difficult situations when they arise. So it's a sort of a training also in that sense, to be able to develop vocabulary, but also ways of discussing certain difficult situations. As I said, there are different methods that can be used. And again, by methods, I mean steps. So procedural steps. Some of these methods are based on dialogical and hermeneutic ethics, such as, for instance, the Socratic dialogue, the Cura method, and the dilemma method. But others are based on virtue ethics. So they take a different approach, such as, for instance, the middle position and the virtues and norms. And this is also something different because all these methods, these groups of methods, they actually rely upon different ethical theories, but because they preserve those aspects that we have discussed before, I think they can be defined as pragmatist. So pragmatism is really an attitude, an umbrella theory that can go along with different specific ethical theories. So it's not prescriptive in that sense, but it's more about the way we encourage this moral reflection, the way we do ethics. And now I'd like to share with you a little bit of my experience. This is not published yet. We are now evaluating our research integrity course for PhD students, but I would like to share with you what happens when we use this sort of methods within our PhD courses. Well, the first reaction is, I have no dilemmas. Here's the ethics police, I have nothing to declare. This is the first reaction, you know? So, but then we put them in charge of the process. We tell them, well, listen, we're not here to tell you that you're doing things wrong. We want to learn from you. We want to hear, what are you struggling with? What are your questions? What are your doubts? What are your dilemmas? And then, inspired by this, and inspired by colleagues, then we managed to create a safe space. And for instance, cases like this come up. This is also a very funny vignette. So someone said, if you torture the data long enough, it will confess to anything. So this is, you know, this idea that if you don't find the results you want, maybe you should tweak your methodologies, repeat your analysis, and maybe you will find what you want to find. So this is a situation that our PhD students encounter many times, and which creates moral stress, because sometimes they know that they just got negative results and that's it. And they want to publish, but their supervisors are not in agreement, or they fear that they will not be published. So they do experience these dilemmas and this, let's say, conflicts as well with their own supervisors. So what happens? What are the benefits of discussing these cases in these settings? Well, we make space to acknowledge their doubts and to acknowledge their gray areas. And we make sure that they feel safe in doing so, and that they feel empowered to also speak up and address these, not only in these safe spaces, but also in their daily practices. We also support them in reflecting on their own professional, but also personal values. Why are certain practices important to them? Why do they think that doing certain things in a certain way is important? So we encourage them to really reflect on them. So to define what are their intrinsic motivations in doing things in a certain way. And also, which I also mentioned this before, we encourage peer support, dialogue, so they can find each other. They can make research integrity a topic of conversation, not just within these sessions in which we do moral reasoning together, but also in their daily practices. And now I come to the last part of my talk, when I would like to share an example of how ethics education for healthcare professionals can be structured following a pragmatist approach. So in general, this is done starting from the assumptions that these are the goals of ethics education for healthcare professionals: improving moral awareness, so making them aware of the moral dimension of their profession, acquiring knowledge of ethical theories and principles as well, but also developing the skills that enable them to deal with the issues when they arise. So, and this starts from the assumption that knowing about ethical theories and norms is not enough, that healthcare professionals also need to know how to resort to these tools when they need to. So in our course, which is within a master on philosophy, bioethics, and health, the course is called Moral Reasoning in Healthcare. So this is what we're doing. Maybe not surprising given the title of the talk. And we really build the course on these two principles. On the fact that theories should be regarded as tools, as I said before in my talk, and on the fact that understanding moral issues means understanding the point of view of those involved in it. So that is something that cannot be done in isolation. So we support them and we encourage them to use collaborative inquiry to redefine and improve their moral competencies. So how is the course structured? There are sort of 4 sessions every week, grouped in 2 and 2. So we start with a lecture on theory, on an ethical theory. And then as teachers, we lead a case discussion, a case reflection inspired by that theory. Then in the next session, we ask students to be the ones who lead the same case discussion on a different case, but using the same method they have experienced in the previous session. And then we talk about it. We evaluate and we compare what happens. And I will just explain briefly how this happens. So in terms of theories, we talk about relevant ethical theories. We talk about principalism. We talk about care ethics, virtue ethics, and dialogical ethics. And for each of these theory, we practice a case discussion using case analysis methods that are inspired by these theories. So for instance, we use the 4 boxes method for principalism. We use a method inspired by the 4 phases of care for care ethics. We use the virtues and norms and the middle position for virtue ethics, and we use the cura method for dialogical ethics. So we tried really to transform theories into tools, and we do it together with students. So then in the other session, students themselves are the case reflection leaders. They work in pairs, and we allow them also to be creative. So they can, for instance, assign roles to their fellow students. So for instance, they can decide, oh, one person is going to be the patient, another person is going to be the nurse, another the physician, and so on and so forth. And they're really in charge of the process. So they have to moderate their reflection and also summarize the results. And then what is interesting, in the very last session, we talk about the suitability of the approach for the case that they were assigned. And sometimes we realize together with students that certain cases are not that suitable for certain methods. They don't require the right entry point to the method. For instance, some cases do focus more on the relational aspects, and there may be some of the ethical theorists do not really focus on that, so they're not really the right ones. So we also help them in really testing the theories in practice and understand them, how to use them and why to use them in specific contexts. And also, of course, we support them in reflecting about their own role as clinical ethicists, as moderator of these processes. Ooh. So I came to the end of my talk. So in sum, I think pragmatism really supports us and gives us good theoretical tools to cultivate the existing ethical expertise of the professionals that we work with as teachers, as ethicists. And also it encourages us to welcome doubts as an aspect of good professional practices. So to transform this in something that should be cherished and not a failure. And also it creates, it can support us in creating spaces where ethics can live. And we had a very inspiring workshop here at this center last week on the concept of living ethics. Well, I think pragmatism supports us to create these spaces where ethics can live. So I thank you very, very much. I have attached a list of reference because some I could not actually include in my presentation. And of course, if you want to get in touch with me, you're very, very welcome. And I look forward to our conversation after the talk.
So thank you so much, Giulia. I think this is so crystal clear and compelling in terms of the vision you lay out. I'm sure there will be questions and comments. And I think given, that you mentioned that doubts and questions are welcome, that there is no silly question to ask you today. And even basic questions are opportunities to learn. So if you have even basic questions about what Giulia presented, I really encourage you to formulate them today. So we are opening up the chat to see if there are questions. I see there are a lot of people very
hearts.
pleased with the talk. Even
Or
the
comments.
hearts and the applause we're seeing.
Or comments or sharing of
Yeah.
experience. I think that's
Mhm.
also really interesting.
So, okay, so participants sharing sharing a lot of enthusiasm for the talk, very clear and informative, encouraging for the next steps. So good.
Thank you.
Mhm. Any questions here from the audience at the RSCM or people online? Any thoughts? Ah, nice question from Nathalie Tremblay, who you now know from the weekend. Can you tell us more about the Cura method? And do you know if it was translated in French? So Nathalie is a clinical ethicist based in Estrie, and she was a participant to the International Living Ethics Workshop this weekend.
Yeah.
So Cura method, yes.
Well, I'm not an expert myself. My colleague who was with us last week, Susanne Messelaar, is one of the developers of this method. So I don't have the steps in my memory by heart. Maybe I can go back to the previous slide where there is actually, it doesn't go back anymore, but maybe we can share it in some other ways. And there was in my reference list the article that actually explains it. But the essence of the method is that it's really simple. I think it's 4 steps. So it's really, really simple. And it's a tool that professionals can use themselves. So in this case, they actually don't need a facilitator. There can be minimal training done so that people feel comfortable in using this themselves. But it's a very agile tool that was developed in collaboration with healthcare professionals. So it's really the result of a co-creation process. But I do not remember the steps at the top of my head. But yes, if I could go back, you could see the reference, but I can't. So maybe I'll share it somehow in the chat if I manage afterwards.
If I can just add to that, I believe this is a method for rapid clinical ethics support when there is no ethicist on board, and in the context of palliative care, people need to answer like specific questions in a kind of convenient way. The Cure method was developed as a kind of a quick and approachable method, and I believe the acronyms stand for concentrate, unrush, reflect, and act, I believe, Cura. So those are the 4 steps. And Susan Metzler, who is the author of this method, presented a lecture maybe 2 years ago on this method here in Montreal. Okay. So maybe we have them actually, we have in our archives her talk for those interested, like Nathalie. Paul Ford from the Cleveland Clinic. Hi, Paul. It's really nice to see you here. Thank you for a very clear talk. A tool is only as good as the outcome that it produces. Can you say a bit more about the variety of markers we can use to prove to others why one tool opposed to another is better for the specific dilemma? Really good question too.
Very good question. Thank you. I don't know if I can produce a list of markers. I don't think that's possible. Maybe something to think about. But from experience and from reflecting on this, what I can tell is that, as I said before in the talk, certain ethical theories, for instance, principalism, who provide us with these 4 quite strict principles, sometimes, for instance, overlook the relational aspect of certain dilemmas. So although they can support us, they only bring us so far. And sometimes while reflecting on a case using this tool, we feel like something is missing, that we've not explored certain aspects of the case. So that's a bit what I mean. I really cannot produce a variety of markers, but once you, if you have like a set of tools that you master yourself, a set of theories which you feel comfortable with yourself, then, and you engage in this sort of self-reflection processes yourself. So after having used one tool or the other, really reflect, oh, was there something missing? Is there another theory that can help me, that can support me in analyzing this aspect or the other? So if you become acquainted with this sort of processes, then I think then it is possible to develop this sort of sensitivity towards this sort of decisions, like which tool could support me best in addressing this case or the other.
Thank you. Moving on to another question from Joanne Mosel. She's asking, how does one reconcile this ethics-informed perspective with barriers to action, such as power-based hierarchies and large systems? I kind of also had this question of how do we deal with people who don't welcome doubts, for example.
Oh, it's a story. I was reading the other question.
Oh,
I
sorry.
was
Yes,
confused.
the first one on top.
Just a minute. Let me just
Sure.
wrap my head around. Ethics informed perspective with barriers to action. Yeah, yeah. So this is something that we do experience. If I understand your question correctly, so your question is asking, how do we deal with those situations in which participants bring out situations in which power dynamics are actually hindering their ability to make ethical decisions or to act in accordance to their moral intuitions. Is this the question? So because if this is the question, we do encounter this every single time when we talk about these issues with PhD students. PhD students, actually, the first thing they tell us, why don't you do this with my supervisor? Why isn't my supervisor in this room? So, and we've also experienced situations in which we actually had mixed groups of researchers from PhD level to full professor. And the way, so two things, I can answer this question in two ways. So the first way is, how do you deal with power dynamics within the group? So if you are in a group and you have people who cover different positions, so there are hierarchical imbalances in the group. Well, the way to approach this as a facilitator, as a moderator, is always to be really aware of it yourself, really be attentive to the dynamics in the room. And if you notice that things go wrong, put the group in charge of the process themselves. So ask them, what's going on here? Why are these people not talking? And maybe ask the people, is there anything that is preventing you from talking in this situation? So really put the process of dialogue, the dialogical process, in the hands of the participants and make them responsible for being engaged in a true, sincere dialogue. The other way is how to approach the frustration of participants who tell you, well, this is all nice and good, but I can't do this in my practice because the culture doesn't allow me, or my boss is not in agreement. Well, as I said, I don't have a clear answer to that. What we do is that we encourage people to become really clear why certain things are for themselves, why certain things don't feel good, why they are not in line with their values, what are the values that support them in certain decisions. And then once that is made clear, that can unfold processes of dialogue outside of the specific session that people are experiencing in that moment. So I'm not sure this is a good answer to your question, but I hope gives some insights.
Thank you, Joanne, for this question. Maybe one or two last questions. We have a question here from Mark Miller, reporting that yesterday we heard a presentation from the Joint Center for Bioethics in Toronto on establishing standards for the hiring, evaluating of a clinical ethicist. How do you assess the student who is now stepping into the position of a clinical ethicist? Further, are there evaluative tools for clinical ethicists as members of a discipline? Do you have thoughts on this, Giulia?
I think this is a very, very big question. And I think there are movements that are going towards the professionalization of the clinical ethicist. Well, when we approach this with our students, we're kind of normative on certain things. So we really, because we do embrace this pragmatist attitude, we tell them that it is their responsibility. They are in charge of the process. They are really in charge of the process. As we said in this living ethics workshop, the clinical ethicist is really an architect. They are in charge of the plan. And then the structure and the materials are brought in by all the participants. So they have to be really aware that that's their role. And they also have to reflect on the normativity they want to bring in to the conversation. And this is also another huge debate, right? What is the role of the ethicist in terms of ensuring the normativity of the outcomes or quality of the outcomes? And personally, we wrote a very short article in which we basically said that this type of reflections can lead to normative conclusions, but because they are the result of a democratic processes in which moral learning and the co-creation of new moral learning happens. So the process is fundamental also to ensure the quality and the normativity of the results in a way.
Thank you. And then we have two final questions, and I'll flip the order around because there's a question that is quite interesting for a conclusion. So moving to the question from Professor Ariel Casio, who you also know now from this weekend's workshop from Michigan State University. Do you have any advice for working with power regulatory authority forces like research ethics boards when doing this work? I've worked with some boards that I think would love it, and other boards that have given guest lectures to my students that boil down to do your paperwork or you'll get in huge trouble. Fostering the exact resistance you described. Is there any way teachers can prime the authorities, in quotation marks, to be receptive and collaborative with this approach?
Well, it's a very good question. Thank you, Ariel, for the question. Well, there is maybe one little trick that we use in our, so to answer your first question, no, unfortunately, I don't have this experience, so I cannot give you any advice coming from experience about our role as teachers, priming the authorities. I don't know if this can be considered priming the authorities, but when we give our research integrity course for PhD students, one of the final assignments which we give them is that they have to organize a meeting with their supervisors, and they have to discuss with them what they have learned, and they have to make an agenda which they send to them in advance with some points that they think are critical for their research regarding research integrity. So we sort of empower them, and we tell the supervisors that they have to show up. So it's actually their obligation. They have to organize this meeting. So this is like a sort of a soft way to include the supervisors, the professors in this process of moral learning by sharing the results of our teaching also with them, and by making sure that students are given the opportunity to bring back their experiences also with their supervisors. I don't know if this answers your questions. I hope it gives you just some inspiration.
Please opening up a conversation for sure. And now maybe a final, yes, Ariel says thank you. Mm-hmm. So a last question from Keltum Zriouil, a student from Université de Sherbrooke in the Applied Ethics program and resident doctor. Writing in healthcare, I believe that MCD, moral case deliberation, is an effective approach to ethical dilemmas in the clinical context. I'm always wondering, though, can situational inquiries generate greater knowledge, thus contributing to the evolution of healthcare, for instance? So I believe the question is, MCD is really good for ethical situations, but what about situational inquiries for the broader context of healthcare evolution?
Yeah, I don't have experience with this myself because I mainly use MCD as a reflection tool and as a teaching tool. But I think that it could support, for instance, organizations if series of MCDs are organized, open MCDs. For instance, my colleagues are organized MCDs with a lot of participants. It can be done. So it could be part of decision-making processes within institutions, for instance, where I have to deal how to develop certain policies. But I don't have a very good answer for this question. I think they can support processes of change if used in a certain way, but I'm not sure I have a very good answer to this question. I'm sorry.
Thank you so much, Giulia. As mille grazie and mille merci, you multiply them, it's a million thanks. So a million thanks to Giulia for a crystal clear presentation, engagement with the questions, and a lot of time for us to get to know better your work. So really nice ending to our 2023 conference series. Et je vais profiter de l'occasion de cette conférence spéciale pour annoncer que la série de conférences 2024 portera sur l'éthique et les cultures organisationnelles dans le milieu de la santé. So next year's series about organizational ethics and organizational cultures. And the first events will be January 25th, February 15th. You have them, you have the full poster there. But January 25th, we have Audrey L'Espérance qui nous parlera d'apprentissage organisationnel et partenariat de soins. And February 15th, we have Georgina Morley from the Cleveland Clinic, from where Paul Ford is, actually, we just heard, talking to us about moral distress among healthcare staff. Donc, merci beaucoup, grazie mille. Et je vous souhaite de joyeuses fêtes. J'espère que vous avez passé une belle année d'éthique en notre compagnie. Et on est toujours aussi à l'affût de commentaires si vous avez des suggestions pour améliorer la série. Merci.